In the past few days, Robert F. Kennedy Jr. took a big step and completely fired all the members of the ACIP panel, 17 members. And this is the statement that was released from the US Department of Health and Human Services. It was done on the 9th of June. And they did this, they said, because they wanted to restore public trust in vaccines by reconstituting the ACIP. And so that's the Advisory Committee for Immunization Practices. And they have been in place for a long time. And they have overseen the delivery or the approval of many vaccines over a long period of time. So this is a big step and suggests that he probably didn't think he could work with the people that were there to achieve the aims that he wanted. It has caused a lot of anger across the scientific community, where people are saying he's trying to dismantle the whole thing. Um, and I never like to see when you take an axe to a whole system, but I got to think carefully about why did he do that, and where is it that I would think that something was not right with the decisions that were being made. Now, what's very clear is that this is not just about the ACIP because they are in the United States, but what happened elsewhere in the world. My concern is to do with children and COVID vaccines. Now, I've listened to many people in the scientific community who would highlight the risks for long COVID and other things, and multisystemic inflammatory processes, myocarditis. But children don't often get severe disease and die. It's not that they can't, it's just unusual. And people oftentimes forget where we were early in the pandemic. And so, what I've done is I have captured a few thoughts from November 2020, and I'll let you listen to what our, at the time in the UK, Minister of Health was saying in November 2020. And this is what he said from a clip on BBC Question Time.
All the people who are either older or work in health and social care or who have a particular vulnerability. And unfortunately, we know quite a lot about who's vulnerable to COVID because of having looked at who's been badly affected over the last 9 months or so.
And the head of the vaccine task force, Kate Bingham, said she was anticipating that only 50% of the population would ever get a vaccine. This was before the Pfizer announcement was made. So is that your anticipation as well? It sounds like it is from what you're saying.
No, not necessarily. We've learned more and more about the vaccine as time's gone on. And the latest advice is that we should go in the order that I've described, and then to the under 50s, but not to children, because this vaccine hasn't been tested on children. It's not designed for children. And anyway, children are very, very, very unlikely to get ill with coronavirus.
Pause there. That is exactly where we were in November 2020. Everybody knew this. The data stated this. We knew exactly who was at high risk. You could argue about why, but nobody was thinking at that point that children were at the front of the queue. And you have to remember that many first world countries were forcing vaccines on children before they gave it to the vulnerable in the rest of the world. I'm sorry, I don't know who is making those decisions, but the point being, if those kinds of decisions were being made, you have to ask about what really were these advisory panels thinking at the time, because the evidence was there, it was known. I also did an interview in early 2022 with Dr. Ross Madison, a pediatrician, a retired pediatrician. And what I've found is that when they're retired, lots of experience, they don't hold anything back because they are not afraid of the system. So you can trust what they are saying. They have no skin in the game other than the fact that they believe the right thing ought to be done. Listen to a little bit of what she said at that time, right before there was the vaccine rollout in children.
And we're in a situation, I mean, I just think back to the days, there's stuff going around schools, educational input about the vaccines, which have pictures of children with smallpox and children in calipers following polio. And then the very next slide is, when can I have my COVID vaccine? Now, that's deceitful to be implying that COVID is on a par with polio and smallpox. Now, when my parents were wondering whether to give me polio vaccination, they just could look round the class at school. I had a child in my Sunday school class who got polio and is in calipers. We didn't need to be bribed, given pizzas, given rollout of vaccines in nightclubs and football stadia, where they were giving free tickets to the football to the first 1,000 people to turn up. The push for this, the amount of money that's been thrown into advertising. Every time you put on your car radio, there's another advert to go and get your booster. I find this very odd. I've never come across a drug before that was so effective that people had to be coerced. And, in many countries, I mean, Austria were about to send their citizens to prison for not being vaccinated. The entire population of Austria will have to have the vaccine. And then they was due to come in on the 15th of February, but they've actually moved it to the 15th of March because they've still got so many people unvaccinated that it was unworkable. But they were going to face a €300 fine the first day you went out, and a €3,000 fine, cumulatively over the next, every time you went out of your house if you weren't vaccinated, to the point where if you couldn't pay the fines, you could do a year in prison. And this is for a vaccine which is still in the experimental phase. And I think we shouldn't lose sight of that. When you say experimental, you're thought to be a conspiracy theorist. I've spent my entire career promoting vaccination for children, but I wouldn't promote a vaccine which had no long-term safety data. And I think it's different. If you're in your 70s and you're at risk from COVID, then you're prepared to take that. It's all about balance of benefit and risk. So if you've got a high risk from COVID and a low risk from the vaccine, then you might think, well, I don't mind about long-term risks because I want to get through the next couple of winters. Mm-hmm. But if you're a child and your risks low, down and down and down to where they're, and then also the vaccines are perversely actually slightly more hazardous in younger than older people, probably because they're mediated by the immune system. So if you've got a healthy immune system, you're more likely to get vaccine injury, although you're less likely to be upset by COVID. So then you get to the point where, hang on.
So that was a very important interview. And I've had the privilege of listening to the scientific community and people who had different opinions for a very long time. And they have been proven to be right time and time again. And when I therefore reflect on what was done, and I look at this point, if you're just joining us, the fact that he has removed the whole panel, he's totally reconstituting this whole panel of 17 sitting members and will replace them with new members currently under consideration. This indicates that he felt that none of these people were up to the level of unbiased science, he said, and transparency that insulated them from conflicts of interest. And as far as I'm concerned, whilst people may make arguments with regards to what happened with children, whether or not they should or shouldn't have been vaccinated, it's one thing to approve it for high-risk children. When you think about why there has to be a look and a reflection on what exactly has gone on. Why have people done what they have done? And in my view, it is certainly reasonable to reflect carefully on what it is that these decisions were based on. I think that there does need to be a re-evaluation of the science. And for me, that focus has to be on the primary pathophysiology, because I can tell you, the more research that I do, the more I understand the disease, I understand why the cytokine storm occurred, it then becomes absolutely clear that children really were at exceptionally low risk. And even if they had some risk, it could have been mitigated through an understanding of the disease. Many challenges ahead, but is this a warning shot that other countries need to reflect in the same way on the decisions that were made by their panels? That's another challenge to overcome. Thank you.